If you think about a medical miracle, it's almost certainly a solution that was invented before 1960 for an acute condition. Emergency surgical procedures to ensure a complicated childbirth wasn't a death sentence, sanitation procedures, antibiotics that ensured infection was an inconvenience, not deadly, eradicating polio, regular waste management procedures that helped control outbreaks like the bubonic plague, sewage systems that replaced the cesspools and open drains, preventing human waste from contaminating the water. The U.S. health system is a miracle in solving acute conditions that will kill us right away. But economically, acute conditions aren't great in our modern system because the patient is quickly cured and is no longer a customer. Starting in the 1960s, the medical system took the trust engendered by these acute innovations like antibiotics, which were credited with winning World War II. And they used that trust to ask patients not to question its authority on chronic diseases, which can last a lifetime and are more profitable. But the medicalization of chronic disease in the past 50 years has been an abject failure. Today, we're in a siloed system where there's a treatment for everything, and let's just look at the stats. As heart disease has gone up, heart disease has gone up as more statins are prescribed. Type 2 diabetes has gone up as more metformin is prescribed. ADHD has gone up as more Adderall is prescribed. Depression and suicide has gone up as more SSRIs are prescribed. Pain has gone up as more opioids are prescribed. Cancer has gone up as we've spent more on cancer. And now JP Morgan, literally at the conference in San Francisco recently, they put up a graph and they showed as more Ozempic is projected to be prescribed over the next 10 years, obesity rates are going to go up as more Ozempic is prescribed. Explain that to me. It was clapping. All the bankers were clapping like seals at this graphic. Our intervention-based system is by design. In the early 1900s, John D. Rockefeller, using that he could use byproducts from oil production to create pharmaceuticals, heavily funded medical schools throughout the United States to teach a curriculum based on the intervention-first model of Dr. William Stewart Halsted, the founding physician of Johns Hopkins, who created the residency-based model that viewed invasive surgical procedures and medication as the highest echelon of medicine. An employee of Rockefeller's was tasked to create the Flexner Report, which outlined a vision for medical education that prioritized interventions and stigmatized nutritional and holistic remedies. Congress affirmed the Flexner Report in 1910 to establish that any credentialed medical institution in the United States had to follow the Halsted-Rockefeller intervention-based model that silos disease, and to downplay viewing the body as an interconnected system. It later came out that Dr. Halsted's cocaine and morphine addiction fueled his day-long surgical residencies, and most of the medical logic underlying the Flexner Report was wrong, but that hasn't prevented the report and the Halsted-Rockefeller engine-based brand of medicine from being the foundational document that Congress uses to regulate medical education today.